Good afternoon, everybody. This is Walter Lanier, a pastor of the Progressive Baptist Church and leader of Micah's Religious Leaders Caucus. More importantly, like everyone on this call, a citizen of Milwaukee County, and looking for resources to help us move forward during this time of challenge. I want to now hand off the call to President John Raymond. He's the president and CEO of the Medical College of Wisconsin.
Thanks, Reverend Lanier. Deeply appreciate everyone being able to join in here on the weekend about a very important challenge for all of us. And again, I'm deeply grateful to all of you. My goals today are to share the medical community's concern about the current state of coronavirus in our community, to share some information with you, to make sure that you have the opportunity to ask questions and to solicit your feedback, and then finally to serve as a resource. What I'm going to try to communicate to you is the gravity of the situation that we currently have in Milwaukee, and to communicate urgency without inducing panic. But I strongly believe every day counts. So if you'll indulge me, I just want to go through a couple of slides. You're probably aware of most of the information here, but I do want to try to use this to set up a common knowledge base for all of us, and then to solicit your input and then questions. So first of all, I want to make sure everyone knows coronavirus is serious. It's not just the flu. It's a deadly virus, and it's infecting Black people, white people, young and old, everyone across the country and across the globe. Nobody's immune to this disease. To date, and very troubling to all of us, African Americans in Milwaukee have been the first cases and have been hit really hard. Almost all of the deaths that we've had in Milwaukee County have been African American deaths. The majority of deaths in Wisconsin also, mainly because many have happened here, have been middle-aged African American males. We really don't know why that is, and this hasn't been the typical presentation in other communities. Now, I believe that as the days go on, everyone's going to suffer from this, but I think it creates a sense of urgency for us to understand what is happening in the near northwest section of Central City, Milwaukee, and why we haven't been able to reach African Americans with information that they need. If we could go to the second slide, please. The virus spreads very easily, despite some information that might be out there on the internet. This is a real problem for us. Simply being around other people dramatically increases your chance of getting infected. And it's at least 10 times more deadly than seasonal influenza or the flu. It is a serious and very, very deadly virus. We don't have a treatment, and there's no vaccine. And that's why people are dying from it, even when there's the best medical care that we can give. It's a particular challenge. It can hurt people that have other health issues like heart disease, diabetes, lung disease, asthma, breast cancer, prostate cancer, diseases that are more prevalent in the African American community than other people. But I still want to stress, anybody can get a coronavirus infection, and anybody can die from it. The spread of coronavirus happens in all communities. It isn't just being brought into our communities by people that have traveled to, say, China or Northern Italy. There's community-based spread, and it's spreading because we're interacting with each other. If I could go to the third slide, please. There are some steps that we all can take to slow the spread of the virus, protect ourselves and those that we love. They're pretty simple, actually. Maintaining a safe distance from each other, 6 feet or more, especially when we're out in public places, at our workplace, interacting at the pharmacy, at the grocery store, any social area. We can prevent the spread by washing hands frequently and cleaning surfaces with soap and water, which are known to destroy the virus, especially high contact surfaces that we interact with daily. So if you're in the workplace, light switches, elevator buttons, common surfaces that we may put our objects on, or returning to our homes from outdoors or from work into our living areas. It's also important to note that this is not a question of cleanliness at all. The virus is spread through close human contact, usually from our hands to our faces, our eyes, our noses. And we know that soap, bleach, and alcohol can destroy the virus. It's important to maintain separation from people within your own home who might be ill, who have symptoms, or who've been advised to quarantine themselves. But mainly, the most important intervention is to protect your personal space and that physical distance when you're out in the community. If I could go to the next slide, please. Some signs that you or a loved one might be infected include fever, cough, and a feeling of shortness of breath. The shortness of breath is probably the most important symptom after fever, but there can be many other symptoms as well. And one of the problems in controlling this virus is that you might be infected for up to a week and not really even know it, yet be spreading the disease. In other words, you can have a mild infection and still be contagious. Now, we know it's easier said than done, but this physical distancing from other people really right now is the only way we can stop the spread of coronavirus in our communities. That's the most important thing we can do to save lives. And as I said at the outset, time is of the essence. The growth rate of this virus is alarming. We're going to double the number of cases here in Milwaukee within 3 days. So for at least the next month, we advise everyone to stay at home, to limit our contacts to as few people as possible. And there's some simple advice that we can give to your congregations. If you're worried that you might have coronavirus, we advise calling the doctor first or the City of Milwaukee Health Department to receive advice. We also strongly request that unless you have a true emergency, to contact your clinic, your doctor, or the health department first. We're doing our best to keep the healthcare environment as free as possible from the virus and to isolate people that might have it so that we don't inadvertently spread it to others. We hope that your doctor advice will be able to give you prompt and timely information about where to go to safely be evaluated and tested. And I just want to end again by saying thank you for taking the time today. We all need to work together, to put our hands together to uplift the community at this time of crisis. It is critical that we provide you accurate information so that we can stop the spread of the virus and protect our communities. Now, MCW wants to be an ally and a source of information. We're willing to provide infographics like we just shared on the screen, as well as talking points that you can use during your sermons or when you're interacting with your congregations. And in the coming days, we're going to be developing, with your input and advice, some information that can be shared on social media posts. And when those come out, we're going to ask you to share them broadly on your platforms and with your network, share them with your friends, your family, your congregation, and your entire social network. Now, I do want to just stop and leave plenty of time for questions and to make sure that you know your questions are valued, necessary, and welcome, and that Reverend Lanier and I are here to try to do our best to bring a sense of community and common purpose to this problem. Thank you. Reverend Lanier, would you like to kind of summarize with your perspective?
Sure. I mean, I will say I have a dual perspective, one being a pastor and then one that's fairly active in community. And one of the challenges, I mean, I'm looking at social media now and looking at a post where somebody's saying, I'm going to read it. Social distancing is stupid. Guys, it's a virus, meaning it will never go away. It will only change and become different. Just like the flu, social distancing will not work. Be educated. So that's obviously a very unintelligent post, but because social media so rapidly shares information, one of the biggest challenges that I see is our messaging, both from your perspective, Dr. Raymond, as a medical professional, and then from Mind Community / Faith Leader. And so what I've sought to do both through social media, but also from the pulpit, is to talk about the combination of faith and wisdom, that we walk by faith and we also walk by wisdom. We make wise decisions, and that it is wise to follow the recommendations of medical professionals in this situation in the same way that we would in other situations. So that's, I could preach it. I won't do that now. I'll wait till Sunday. But that I see that as one of our biggest challenges, Dr. Raymond, and then also just identifying where our clear sources of accurate information are. I see that to be one of the biggest challenges in front of us.
Thank you. Now, we do have the opportunity for people to ask questions. And Eric Johnson, I think, if you can look at your chat box, there's an opportunity to submit questions by typing.
That's right. Hello, Doctor. Hello, Reverend. Very good information. This is Eric, the technician running the webinar today, everybody. Doctor, I'll just read the questions off to you, and then you two can address if that's all right with you. And I'm going to go mute in between so my dogs don't take over. First question is from John Daniels III. He asks, no treatment, no vaccine, practice self-isolation. I understand that. Does MCW have a test for the community, and what are the health systems doing together to get the information out to dispel the rumors?
Okay, great question, and not one that's easy to answer. Yes, we do have testing capability here, but it's very limited. Not because people aren't willing to do it or that we don't have the machines. We don't have all of the ingredients that you need to do the test. There's a critical shortage of what we call reagents. So there are tests that we can do. We've generally followed the Center for Disease Control guidelines about what to do when you don't have very many tests. And there, we will be able to show you what the priorities are, but generally what you want to do is test your frontline healthcare providers first and foremost. There's two reasons for that. One is we know that 20 to 30% of the people that have been infected now all over the world have been those frontline healthcare providers, doctors, nurses, respiratory therapists. So you want to protect them. The second thing is you want to make sure they're not spreading the virus to other people. So that would be the top priority. If there are other tests available, then you try to test the sickest patients that you might be bringing into your hospital. Again, you want to make sure that you know what you're dealing with and that those patients are isolated as much as possible so that they don't spread the infection to other people in the hospital. After that, we really don't have that many tests right now, and this is really one of our, I think, national problems, that it's a tragedy in many ways that we don't have those tests available in our communities. I know that the government and many private vendors are doing everything they can to develop tests that are available in the front lines so that we can test everyone. The second part of the question, John, is are the health systems working together? Yes, they are. Doing everything they can to share best practices, to share resources, to message together so that people have good information and understand where we are. But I would say one of our biggest challenges right now is that we don't have enough tests.
Very good. Thanks, John, for that question. Second question is from Sam. He asks, is the virus in the air? What about doing funerals at funeral homes and grave sites?
Yeah. Yes, the virus is in the air. It is spread by respiratory droplets. In other words, if you cough, the virus is in some of the liquid that you cough out, which can be aerosol and persists in the air around you for hours in some cases. Usually that will eventually settle onto touch surfaces, and that's why if you touch a surface that's either been touched by somebody that has virus on their fingers or coughed, you can spread it. Funerals, really hard to say. I will tell you, in China, they were overwhelmed and cremated people very quickly without funeral services. They're doing some of that in Italy as well. But other countries and other municipalities are limiting the number of people that go to funerals, and the people that work in funeral homes are taking extraordinary precautions to make sure that they're not exposed to the virus, either from the clothes or from the deceased individual. So this is a huge challenge, not just medically, but also socially. For many of us, we're not able to go through the steps of the grieving process and to be able to say goodbye to our loved ones. So this is a huge challenge.
Want to add to that, John, if I can, just in terms of resources, there is an excellent global group on Facebook. It is the Multi-Faith Clergy and Spiritual Communal Responses to COVID-19. Multi-Faith Clergy and Spiritual Communal Responses to COVID-19. It's multi-faith, it is global. So we're hearing from clergy in Italy, clergy in China, clergy in New York, and they are responding to a lot of these questions that are confronting us now and that are going to confront us in the future when we have to look at funerals, trying to visit the sick, weddings, even for those of us who are the Christian faith, thinking about communion and the Eucharist. So multi-faith clergy and spiritual communal responses to COVID-19. I know that's not something that MCW can whatever co-sign. This is not their statement, this is my statement. But as a practitioner, I found it helpful and comforting because these are unique issues for us, and the community is going to lean on us more.
Great, gentlemen. Lots of good questions coming in, so I'm going to try and pick up the pace here a little bit. Pastor Darrell asks, how is MCW actively assisting in the African American community to address the spread of COVID-19?
Well, great question. We're trying to lean in and use our connections, but we're having contacts like we're having today to make sure that we seek your advice and that we speak a language that people can understand, rather than medical speak, messages and words that resonate in the community. We want to be a source of truth. We're actually trying to do that for all of Milwaukee, and we have 2,000 experts here that are available to try to give you best advice. I'm certainly not the only one, and I'm not the best one for most of the questions people would ask, but we want to be an ally, we want to connect with you, and we want to be a resource.
Next question is from Raymond. He's asking, have you all considered getting athletes or other public figures to do PSAs to reach out to young people and teens?
Yes, thank you very much. And that is one of the efforts that is ongoing that MCW is part of, but obviously we don't have the deep connections or the understanding to make the PSAs happen. We had a meeting this morning with Reverend Walton, virtual meeting, and Sheriff Lucas, who are going to try to mobilize the community to do those PSAs. And to be honest with you, I personally think those are going to be much more impactful than having webinars like this.
Wanda asks, the faith community is just one aspect of reaching the community. How do we reach the broader community to dispel messages like the one Pastor Lanier shared earlier?
Well, thank you, Wanda. In part, this is what we're asking your help to try to do. You know, we've been doing a good job, I think, the medical community in engaging with the business community, and not such a great job necessarily reaching out to a lot of our patient groups and other constituencies. And we need you to use your networks to help us make those connections.
Next one's from David. Given the numbers, do we have a sense of when we are going to hit an apex? How severely will the need for ventilators and ICU beds outstrip what we have locally?
Thank you. You're asking probably the most important question, because the problem in Italy and now New York is they're exceeding the capacity of their healthcare systems to even provide beds for people, let alone the number of ventilators that are necessary. There are a lot of models. We're trying to keep the model here in Wisconsin pretty simple. But it looks like sometime between the second and third week in April, we're going to reach a tipping point where we may not have enough hospital beds or enough ventilators to take care of everybody that's going to need them, unless we can really intervene with this social distancing and slow down the spread. There are a lot of things the hospitals are trying to do to increase their capacity. I'm sure you recognize that in other states, they're using hotels and dormitory rooms from colleges that have been closed for step-down units for people that don't require intensive care but require some nursing care. The health systems here are already looking into that. They're expanding the internal capacity of their hospitals to be able to provide higher levels of care, but there's only so much you can do. There is a device now that can split a ventilator tubing 4 ways so that you can ventilate up to 4 patients with a single ventilator. Again, those things will help, but at the end of the day, and this kind of gets back to John Daniel's question about testing, if your frontline healthcare providers are sick and they can't be on the front lines anymore, we can have all the hospital beds and ventilators that you want, but if you don't have enough nurses or respiratory therapists or intensive care unit doctors, we're not going to be able to deliver that care. So again, the take-home message is if we don't do something very different, second or third week in April, we're going to be faced with a crisis.
Next question is from Eleanor. She asks, do we need to keep individuals out of our houses of worship for a period so that the space is made clean?
I can only give you my opinion as a healthcare professional and not as somebody who is a pastor. But what I can say is different states have taken a different approach to this. Some have been relatively restrictive and said no church. Others have said if you exercise appropriate social distancing, physical distancing, maintaining at least 6 feet from each other, good hand washing, provide hand sanitizer, and limit the number of people in the space, that's okay. I would need to really hear from our faith-based leaders what their current thinking is. But again, from a medical perspective, minimizing that close personal contact, high density, high volume interactions is really all we can do right now to slow the spread. Reverend Lanier, did you want to weigh in?
Just briefly, and this is me and my theological framework and teaching. So before we ever got the order from the governor, we decided based on a rubric that I saw, a public health rubric about how to scale back church and to be wise. And it's what I have been talking about in particular, because I've also seen it a lack of faith. And so this is in particular a more Christian-centered message, but I just pointed out numerous times in biblical narratives where biblical personalities, including Christ, in essence, quarantined and removed themselves from harm's way. And so I thought that was important, both in framing that it's not reflective of a faith issue, and then ultimately the leaders will decide what they'll do. But we thought it was both an act of faith and wisdom to no longer worship in that faith. About 2 weeks ago, we made that decision.
Very good. Next question is from Eugene. He asks, what is our timeline for getting access to more tests?
Thank you, Eugene. That's a question I ask every day. Having the tests is really the most important medical intervention that we can possibly have. If you know who's infected, you can really intervene much more quickly, because again, people can be infected and not have symptoms early on. And we can focus all of our resources on those people and not have these severe social distancing or physical distancing interventions. So what I can tell you is our pharmaceutical companies here and across the world are working very, very hard to be able to provide the test, not only from humanitarian purposes, but just good business for them. The problem with the test right now, again, is it's not widely available. The turnaround time takes about an hour. It takes about 24 hours. What we need are tests that are cheap, that you can deploy right out in the field and that you can have a read on in 15 minutes or less. I'm becoming more confident that within the next month we'll be able to do that. There's a lot of work going on, but I want to make sure that all of us understand the current state is we just don't have enough tests, and that we've got to deal with that right now. And also, again, at the risk of proselytizing, say that we are in a crisis right now, that we're going to have a doubling of the number of cases within 3 days. And then if you double the doubling and you keep doing that, every day that you miss out on, you can have many, many more patients that are sick, and we're going to be overwhelmed. So again, we need those tests, and there are a lot of smart people working on the tests, but we're not there yet.
Next question is from Larry. Do you know how long it will be before proper testing will be available, specifically in the inner city? Will there be a testing station set up somewhere like St. Joseph's Hospital?
Thanks, Larry. There's been a lot of press about drive-through or drive-by testing. I know some of the health systems tried to set that up. It really was mainly so that they could screen people and not have them go inside their clinics or inside the hospitals and spread the disease. There just aren't enough tests to do that right now. If you think about the United States, if we're going to do this right, you would test everybody at the same time. That's 350 million tests. Until we have those available, it's going to be hard to do that. I will tell you that Froedtert and a number of the health systems here are working overtime to ramp their capacity up, because we know that people want those tests in their communities. And I know that's a goal, but we're not there yet, and we're probably not really that close to it. If I could just add, we probably can do 1,000 tests a day in Wisconsin right now. And we have 6 million people. So I just want to make sure that people understand the magnitude of the problem for us right now.
Next question is from Markeisha. Staff and students of Washington High School lost a very beloved person to complications with the virus on March 25th. School ended March 13th. Are there any resources available with language broken down to reach the youth?
Markeisha, it's a great question, and MCW is willing, with the right input, to be able to try to provide some of those resources. I'm sure that the faith-based community is rallied around Washington High School and the students that have been affected there, but we probably can do more. And you know, you're asking the same question that people here are asking, as our colleagues are going to die. We've already seen that in New York and Italy. So this is an issue that's going to touch every one of us, no matter what neighborhood we live in or what walk of life we work in.
I have a couple of resources. One, I would again recommend folks to that group I mentioned earlier, again, because it's global and some people have already experienced what we're going to be experiencing. And have considered these from a faith leader perspective. Second, Scaling Wellness in Milwaukee Swim, which is started by Marquette University President Mike Lovell, and more specifically his wife Amy. They have we're
still here, Dr. Raymond. I think Reverend Lanier is freezing up on his
about
internet.
7 resilience screens that are just one-pagers that are specific. I can get those resources out. I'm also posting.
Thank you, Reverend Lanier. Would you mind posting those in the chat area? Do you see the chat area? Could you put those in there, please? All right. Thank you, sir. Next question is from Minister Syfax. He asks, in the areas that have a concentration of the virus, are there any immediate actions being taken to share information to those specific areas, such as Sherman Park, and to reiterate its importance?
Well, thank you, Minister Syfax. we're doing our best. I think what we're trying to do today is to make sure that information gets there. And we're calling on you and your networks and your connections with your congregations to be able to do that. What I also want to say is the virus it's going to be everywhere. We need to go into the areas that are feeling the brunt of the spread of the virus first and foremost, but this is a problem for our entire community. It doesn't really matter where we live, that within the next days to a week, we're going to be facing this challenge everywhere in the Milwaukee region.
Next question is from Wanda. People are actually getting well and leaving the hospital. What are the discharge orders for those patients when they leave the hospital?
Great question, Wanda, and I actually don't know because I haven't discharged any of the patients. I'm assuming that they will be given instructions for their health and well-being, but also probably be restricted and continue that physical and social distancing for at least 2 weeks. What we know is that even in patients that are convalescing or recuperating from the virus, that there's still the possibility that they could spread the virus.
Bishop Hines asks, because the virus is airborne, is there anything else we can do to destroy the virus in our immediate airspace?
Bishop Hines, thank you. No, it's a great question, and there's not really a definitive answer. I know that people have brought back ultraviolet lights that many of us that when we went to grade school back in the 60s had it in the classrooms. Not really sure whether that works or not. I'm sure you've seen pictures in Italy, in New York, Chicago, and in China where people were out and spraying disinfectants out on sidewalks and public touch surfaces. But just in terms of the airborne spread, most important thing you can do is try to maintain 6 feet distance between you and other people out in the community. That doesn't mean you can't go for a walk and get within a few feet of somebody as long as you don't touch them, and it's an incidental passing of each other. But we really do need to try to be out of each other's space.
Eugene had a second question, and this is, I think, what he meant by that. What are the rates of infection for some of the frontline workers? I think he might mean healthcare workers. And then some pastors might have bivocational careers, so they might also be working another job in addition to being a pastor. And I guess I'm not sure how else to interpret that question, Eugene. So if you want to follow that up with another one, please feel free.
I'll try to do my best to answer it. We know that 20 to 30% of the people that have COVID-19 and a large number of people that have died from it are frontline healthcare workers in China and Italy in particular, but also in New Jersey and New York now there are a number of healthcare providers that are gravely ill. The reason for that is that it's hard for physicians, doctors, nurses, respiratory therapists to maintain that physical distance when you're interacting with somebody who's sick, and that might not necessarily be somebody that you know has coronavirus. It could be somebody that was in an automobile accident or had another trauma or a heart attack. So those people truly are on the front lines. But I also want to say other people are on the front lines. People that deliver our groceries, people that are in service jobs that are deemed essential. And so they're still on the front lines and working. And I know that a lot of our ministers have other jobs like that as well. Some of them may even be frontline healthcare providers. So this is a real problem for all of us. And it gets back to we don't have enough testing to be able to know who's infectious and who isn't, because you can be spreading the virus when you don't have symptoms. So Eugene, if I didn't answer that question adequately, please feel free to ask another.
Next question is from Aaron, and it seems to be more for Reverend Lanier. Might we put ourselves at a risk of lawsuit if there is an outbreak in our congregation?
How Wow. I would say that potential is there. I do also have a law degree. And so, but this is not legal advice. Um, I mean, I think that potential is there, but I think so that's another reason not to do it. Um, but I think before we get to the lawsuit risk management component, I personally, this is just my personal belief, as a matter of wisdom. I remember about 3 weeks ago, right when we started to make the pivot, we told we had one more service. We told the elders to stay home, and they would not stay home. They were faithful. They were following the model of their leader, who was in the sanctuary in that church. So they came. I told a couple to stay home. They said, no, if we're having church and you're there, we're going to be there. And so I see it as an act of love and wisdom. I suppose in theory, there could be some lawsuits there. But I think long before you think about legal ramifications, we need to think about health, wisdom, what the public health providers are saying, and how we model proper behavior, because our people will follow what we do.
Next question is from Brigitte. Are there any resources for those who are running low on their medications?
Thank you, Brigitte. Good question. There are critical shortages of some medicines, but most are available. So we've been recommending that you work either with your pharmacist or whoever your primary care provider is, or the health department, to try to get connected with the supply of the medication, just like you would under normal circumstances.
Next question is from Pastor Walton of Calvary Baptist Church. Why do you think the virus is affecting the African American community in Milwaukee in the way that it is?
I don't know, but it's deeply troubling to me and to many that I work with. And to our knowledge, this has not been something that has happened in other communities where the initial outbreak has been in the African American community. And we're deeply troubled by it. And in part, this is one of the reasons why we're asking for your help. First and foremost, we need to educate everyone so that they have good information to be able to protect themselves and their loved ones. And secondly, I know that the Milwaukee Health Department is sending epidemiologists into the community to try to trace contacts and see if there's a pattern that we missed early on, and that they're doing that work right now.
Pastor Anthony is asking, can MCW create a statement we can share with our networks for consistent messaging, which will eliminate confusion?
Yes, thank you, Pastor Anthony. What you see on the screen is our first attempt at that. We've been sharing similar information really nationally through our website for the last 2 weeks. We're trying to make the information relevant to the different populations that might be reading it. And again, this is our first shot at it, and we're updating our information each and every day. What I would ask you and everyone on the phone to consider, though, is if you think this is useful information and you're delivering your sermons online, either in real time or available for replays, please think about using this information either in your sermon or as something that you could refer to. We've got to get this information out to our community so that people take it seriously.
This is your technician, Eric, again. And just so everyone knows, there's a handout panel in your GoToWebinar controls where you can download the slides that Dr. Raymond prepared for today as a PDF, and then distribute that electronically to your parishioners if you like, or other friends and neighbors that you know out there. So under handouts, you can download the PDF, and we'll also send it in a follow-up email in a couple hours after the webinar closes.
And Eric, if I could, I'm sorry, Eric, I want to make sure I give the question the full answer possible. We do have a team of MCW communication specialists, and community leaders that are working together to make sure that we have these documents available to you and that they're culturally relevant and sensitive. And again, any advice that you can give us and our team, we would appreciate, because I just want to tell you, I personally feel, and all the leaders of our institution feel, an enormous sense of responsibility and urgency to get this information out there.
Harold asks, will masks protect us from the airborne virus?
Thank you, Harold. It's a question my wife asks me every day. In the healthcare environment where you have a lot of people that might have the virus, yes. Out in the general community, probably not. The most useful, I think, deployment of a mask is if you think you might be sick, you should wear one to prevent spreading it to other people, especially if you're going out. The evidence that it protects you from someone else, again, outside of the hospital or some healthcare environment, it's not very good. It may make you feel good, and I think that's why we saw that all of our pharmacies were out of masks about 6 weeks ago. But there's no good evidence that that actually helps you prevent having the virus if you go out in the community.
Aaron asks, is it wise to wash and reuse masks?
I would say no. But as many of you know, the CDC recommended that healthcare providers on the front lines that were running out of masks should use bandanas and scarves. Reusing an N95 mask, which does filter viral particles out, it is something that people have actually been forced to try to do. What I would tell you is what we know now about reusing masks is the most effective way to reuse them is to use ultraviolet light to try to sterilize them between uses. And those protocols are being rolled out in some hospitals. But just in terms of at home, I'm not sure that washing is going to really do much.
Reverend Lanier had entered into the chat panel a link to a Facebook group on multi-faith clergy and spiritual communal responses to COVID-19. And Reverend, just so you know, I responded to your post in the Q&A panel to all of the participants so that they got that answer pushed out directly to them. So next question is from Kurt. Since the virus is airborne, is it recommended that all people wear masks even when they're outdoors? And sorry, that may be a repeat of a...
That's fine. It's good because I think that's top of mind for everybody. The simple answer is no, it's not recommended. If you believe that you might have been exposed and you need to go out, you can wear a mask as a humanitarian gesture to make sure you're not spreading the virus to someone else. But the value of wearing it as a preventive measure for yourself, it's more psychological and emotional than it really is based on evidence. So no.
Wanda asks, based on what I'm hearing, this could be a revolving concern. If coronavirus is airborne and there's no cure, then how does this end?
Well, I think you're asking the question that all of us need to ask is there light at the end of the tunnel? Without getting into too many details, I think what we're all hoping for is that we buy enough time that we can repurpose an existing drug or rush to market a drug that specifically works on this virus. That's probably not something that's going to happen in the next few months. We're hoping for a vaccine like we have for influenza. That's probably a 12 to 18 month period of time before that can be developed and tested and made available for everybody. So we're really, really buying time. You know, sometimes pandemics like this go away if you're able to isolate the people that have it and contain it. They managed to do that in China, at least with the first phase of the pandemic. It remains to be seen whether we're going to be able to do that here or whether there'll be a second wave that comes in the fall. Anybody that's a history buff that's read about the Spanish flu and in 1918 knows that there were actually 3 waves of the pandemic. The first happened in the spring, and it wasn't that bad. Most of the people died in the fall with a second wave, and then there were a number of fatalities the next year in the spring. It's very possible that this virus may be persistent and may be something that we have to deal with for many years to come. The good news about this virus is it does seem like it mutates very slowly. So what that means is if you develop immunity, if you are exposed, you make it through, you recuperate, you're probably going to have immunity from getting it again. And it also means that if we ever have a vaccine, that it's probably going to be effective for a reasonably long period of time. But right now, we're at the beginning phases of a marathon. We're maybe in the first mile of a marathon.
Aaron had a follow-up question about the masks. Could you please clarify how the masks are effective in hospitals, but not out in public?
Mm-hmm. I think out in public, you're not likely to be running into somebody that has the infection or coughing on you if you maintain the appropriate physical distancing. In the hospitals, you can have a lot of people that have been exposed to it or that may have it. So you need that because there's just a higher level of exposure. So please understand, I'm not telling you not to wear masks. I'm just saying that the evidence that it's effective if you're out in the general public, there just isn't good evidence that it works.
And then this is the last question that we have coming in from Arnold, Minister Syphax, I believe. In trying to discover the cause of this virus and its increase in the African American community, has there been any testing with white blood cell count decrease?
Minister Syphax, I don't think so. And again, it is unusual that it started in the African American community here, but I have a feeling that within the next week, this is going to be a problem for everybody. The genesis of the virus and whether we can detect early symptoms and signs without, the widespread testing specifically for the virus, a lot of work has gone into that, and there is no specific test.
Reverend Lanier, you actually had a question, I believe.
Yes. So I know in some ways, maybe even many ways, we are collectively behind where we would, could, or should be. And I know that certainly in other countries, and I think most recently I saw in Chicago, they're anticipating capacity needs and repurposing other buildings. I think the McCormick building is one that I saw that they're planning for. I'm just wondering who is, what entities or teams or orgs are anticipating those types of capacity needs for our city and county?
Good question. I know for certain that the health systems are deeply into planning and trying to make the connections and see if they have the capacity to be able to expand their beds. So I'll just give an example, and please don't take this as they're going to do it. But we have universities now that are closed and have dormitories, and many of the leaders of the universities have contacted the leaders of our hospital systems saying that that space that's available and could be repurposed. Other areas where hotel volume is down, and I know we're experiencing that here, you could repurpose hotels. So let's just start with the health systems are looking into that. I'm sure that the municipalities and their health departments are also looking into it. I'm not sure what we're doing at the state level. And please, I didn't say that we're not doing anything. I'm just not aware of what's being done there.
If you're in one of those conversations, a thought might be, I can't speak for anybody online, I'm just thinking about assets that some of our churches, most of them are going to be empty, and there may be some utilization of facilities there. So that's a very simple thought. It'd be a lot that would have to go into it. insurance issues, but I think that that's something that should be considered, especially if the numbers are dramatic and we just don't have space for people. So that should be something that should be in the mix just for conversation as a possibility.
Thank you, Reverend Lanier.
We had a little flurry of more questions, gentlemen, if you're willing to stick around for another few minutes.
As long as people are willing to listen to us.
Okay. Well, Pastor McVeigh would like to know, is there a difference in how long this virus can live on indoor versus outdoor surfaces?
Great question. The answer is probably yes. It's probably more durable indoor than outdoor based on what we know about other viruses, but there's no good evidence for that right now. What I would say though is, outside it rains, the wind blows, there's more air circulation. So I would say that it's probably more durable indoors than outdoors.
We have a question from David. There seems to be a lot of people with type A blood that are more susceptible. Has MCW gotten involved with the genetic side of this equation and its tie to genetics, I think is what was said there.
Right. Sounds like you know more than I do. I'm not aware that there's a blood type predisposition. But what I would say is we do have faculty that work at the Blood Center of Wisconsin University who are world experts on blood typing and the association of various genetic diseases with blood types. And I'm sure that they're working on that. So thank you, great question.
Another question from Brigitte. When you have symptoms and are self-quarantining in the home with multiple people, what are your recommendations to make sure that others don't get it?
Wow, that is such a great question, and thank you for asking it, Brigitte. I'm just going to go with the Centers for Disease Control recommendations, and they're pretty significant. They say that you should maintain extreme social distancing from each other, as the person who may be well with the person who's symptomatic. And that even might go as far as having, if you can, separate bathrooms or disinfecting the bathrooms after each use, being very careful with plates and utensils that people use to eat, and even with clothes. There's some evidence that if you take your clothes off and you've coughed on them or touched them with the virus, that may be able to redisperse the virus into the air. So people are recommending very significant, almost extreme precautions. But again, common sense. Both the person who's symptomatic and the people that aren't should be washing their hands, should be trying to be as separate as possible.
Pastor McVicker has another question about masks. For people who must use public transportation, might that be a good way to wear a mask or good advice for them on public transportation? Thanks,
Reverend McVicker. Again, I can't help myself because I'm a scientist. There's no good evidence that using masks in public protects you. But I would say that if it gives you some measure of comfort, as long as you don't relax about the physical distancing, by all means wear it. And to be honest with you, if I were taking public transportation, I'd probably wear a mask. And again, that's not a science-based answer. It's just an answer that makes me feel comfortable.
Pastor McVeigh again, some of us are members of local service clubs. What might service clubs be doing to help meet community needs?
Well, I think Reverend Lanier can probably chime in here, but what I would say is help us spread the word. Make sure that people that are in quarantine are getting meals, that people are touching base with them. It's a lonely disease. We ask people to isolate themselves. They may already not be people that have a lot in the way of social support or financial means. And we need to be reaching out to the people that need those connections the most. Reverend Lanier?
I would say try to touch the air, if you will, and touch the ground. by the air, I mean there's some organizations. I know that the United Way, Greater Milwaukee Foundation, and a couple of others have collaborated to create a fund. And so they're taking monetary donations and coordinating from the top. And then on the ground of the community, if you think about the least of these, there are organizations that are kind of more foot soldiers and troops on the ground, Hunger Task Force, Street Angels, connecting with 211, people that are doing food distributions that need goods. At some point in time, they were doing drop-offs. Now what I'm seeing more frequently is an ask for people to send stuff by way of Amazon because of the social distancing. But there are some places that are still looking for food drop-offs, diapers, stuff like that. If anybody is looking to do either one of those things, you can certainly email me at pastorlanier@gmail.com, and I can plug you into who I know is doing coordinated work. But the need is clearly there.
We have 3 questions left, and then we'll be at the top of the hour, gentlemen. So maybe we can take these 3 and then do another one of these in another few days. Or if there are questions, please send them in now, everybody. The next question is from Kurt. How do you protect yourself when you're going out for a run or a walk and you're passing by other people?
Thanks, Kurt. It's probably okay to pass by them. Don't bump into them if you can avoid that. It's okay to say hi and wave. I wouldn't shake hands, and you're probably going to be fine. Incidental passing through each other's personal space bubble, especially when you're outside, probably not much of a risk to that. And again, there's a psychosocial element of how we respond to the disease, and we need to do our best not to be isolated. So even though we say stay at home unless you absolutely have to go out, at least right now, if you can maintain your personal space bubble and take a walk or run, that's probably good for your mental and spiritual health.
Aaron asks, can you please speak to the theory that using Advil and ibuprofen are bad for you, and that you should instead take Tylenol as a preferred medication?
Excellent question, and I thank you for that. There's no definitive evidence, but there's enough out there that probably I would stay away from what they call non-steroidals and use Tylenol, but we really don't know for sure.
And then your last question, and then we've got a couple of comments. Wanda just wanted to say, thank you, MCW, for coordinating this discussion. I pray that we continue to pray for one another and support one another in this time of great need. Bless you all. And then Eugene had a final question. Do N95 masks give extra protection?
Okay. First of all, thank you, and God bless you, Wanda, and everybody else on the call. And to answer the outstanding question, yes, N95 masks do give you protection. They are specifically designed to filter out small particles that would include viruses, and they do that very efficiently. You know, you can buy N95 masks for hobbyists and people that do construction work if they're available on the shelves. So if you have one, use it. And you can reuse it, just be careful with it as best you can. And my advice, again, it's scientific, but it's not based on any evidence. If you're out and you're touching things with your hand, make sure you wash your hands before you touch the mask if you're going to reuse it.
We had one more question come in that I think is a really good one from Pastor Kenneth Locke. Since the virus doesn't seem to have an expected digression period, should we as pastors not expect to return to active service this summer?
Thank you, Pastor Locke. You're asking the question that's probably the one that everybody's asking. You know, we all have businesses to run, we have our lives to go on with. We want to know, when is this going to end? If we can get an inexpensive test that we can give to everybody and that has a rapid turnaround time, I think we can get this under control within weeks to a month. We're not there now. I can tell you at MCW, we're planning to not have any more classes through the summer. We're prepared to do that, and maybe even into the fall. But I think if all of us just pray that we either find a drug that works or that we can get that testing done before too many people die from this, and that may be the best thing that we can do right now.
I had one final remark come in, and it's, I'll mention at this point that in a couple of hours, a final email will go out to everyone who registered here with the full slides and any other information that Dr. Raymond's staff want to send over to me, or Reverend Lanier would like to send over to me. But I had one final request that Reverend Lanier, you might want to close with a special message, and then we can close down for today. I think you're muted, Reverend, sorry.
Here we go. Okay. Yes, I will. Yes, I will close us in prayer. So let us all prepare ourselves to pray. Lord, we come before you this afternoon, humbly, reverently, seriously, and confidently. As people of faith, I know that I am thankful to hear that the president and CEO of the Medical College, God, is a man of science and a man of faith. And we need both, Lord, for you are the master of science, and you created brilliant minds to find brilliant solutions, Lord. And so we're thankful for MCW and all their resources. We're thankful for all who are on this call seeking accurate information that we can be best equipped to serve the people who are the members of our congregation, but also, also to be clear voices in community with accurate information so that we can message and fulfill that function. God, I pray for everybody on this webinar that you would strengthen us and help us to be gracious to ourselves, that we would engage in healthy self-care as we hunker down for this marathon journey. Help us to take care of ourselves mentally, physically, spiritually, psychologically, to not be frantic, but to move with strategic excellence, wisdom, and faith. God, we surely pray for a rapid acceleration of testing. We pray for the brilliance of business, government, science, the common man, the common woman, that they would accelerate the production of tests, the production of masks, and certainly, Lord, a vaccine and a solution. We pray that a message of clarity would make its way out around Milwaukee City and Milwaukee County and even the state of Wisconsin, that we would settle into the truth of where we are in this and prepare. Lord, I pray for all who are on here who have a message to deliver in one form or another to their respective congregations and in their homes and in their circles of influence. Help us to be on one accord, God, to be the best that you have created us to be. And even in doing that, trusting that the final answer rests with you. I lift this prayer in the name of the one to whom I pray, who is Jesus the Christ. And I say, amen.
And amen.
Amen.
Thank you, gentlemen. We'll shut down now.
Thank you.
Yep.
Thanks, everyone. God bless.
God bless.